The clipboard set up for a paying chief complaint, and this will be done before entering the room. We'll write down our patient's name, their chief complaint, and their vital signs. Next, we'll draw a cross in the middle of our paper. On the upper left-hand corner, we're going to write down the mnemonic OLD cards. On the right corner, our review of symptoms. On the bottom left, the mnemonic PAM, FOS, and the bottom right, a 3-column table for the differentials we'll write down based on the doorway information. The O for onset, or when did the pain begin? Did it come on suddenly, or was it more gradual? And for our patient note, we'll like to write down the precipitating event, or if there is none, no precipitating event. For location, we'll ask our patient to point with one finger. For the duration, we want to know, is the pain constant or coming and going? If it is intermittent, we'd like to note the frequency. How long is an episode of pain lasting, and how many episodes are you having per day or per week? And next, we can note the progression, or if there is none, we'll include in our patient note, no progression. To characterize the pain, we'd like some descriptors. For example, is it sharp or dull, among others. And if it's a bodily fluid, we're going to introduce our mnemonic A, B, and C for amount, blood, and color. So very important, any bodily fluid, be it a cough or diarrhea, we want to know for our patient note the amount, blood, and color. Aggravating and alleviating factors, or if there are none, we'll write no aggravating and alleviating factors to show that we asked. Radiation or no radiation, treatment, and severity on a scale of 1 to 10. Next, if it's a non-pain chief complaint, our clipboard setup will include pre, present, and post columns. The pre column, for example, if it's an alcoholic, will be the age that they started drinking, or if it's a hypertensive, when were they diagnosed. Present are some descriptors of their current disease state. So for example, for an alcoholic, we want to know how many drinks they're having per day. Or for a hypertensive, we want to know what their BP log is like, or their medications and its compliance. And post is very similar to review of symptoms, and we're trying to get at any complications from their current disease state. So for example, for an alcoholic, do they have any tremors or abdominal pain? Or a hypertensive, do they have any headaches or change in vision? And as always, we'll use our mnemonic OLD cards as a guide if the history elicits a pain complaint. On the upper right-hand corner, we're going to begin our review of symptoms, and we're going to start with a transition sentence. To better understand, I would like to do a review of symptoms. Is that all right? Starting with systemic symptoms, we're going to ask of a fever, a change in weight, travels, or sleep. Next, working our way from the head down to the bottom, we're going to ask of headaches, a change in vision, a change in hearing. Any upper airway symptoms, such as a runny nose or cough, or lower airway symptoms, such as shortness of breath, chest pain or palpitations, abdominal pain, a change in bowel movements, or nausea and vomiting. And again, for any vomitus, we want to use our mnemonic A, B, and C to note the amount, any blood, and the color. Any change in urination or urethral discharge, any joint pains or skin changes. On the bottom left-hand corner, we're going to use another transition sentence. To better understand, I would like to review your history. Is that all right? For past medical history, for the layperson, we can ask it if they've been diagnosed with any medical problems in the past. Also, along with past medical history, we want to know their past surgical history. And we're going to introduce another technique or mnemonic to help us quantify and qualify. We want to know for our note, when was the surgery and what was the outcome? Was it a success or any complications? For allergies, we want to quantify and qualify. How long have you had and what happens after? For the medications, we also again want to note what their dose and if they're compliant. For their family history, we want to focus on MI or hypertension, diabetes, or cancer. If our patient had a loved one that passed away, we want to respond by saying, "So sorry to hear that. That must have been very hard on you. From what did they pass, and how old were they? And then how are you now?" For OB, we'll quantify with gravida, or the number of pregnancies, and we'll qualify with para, or the outcomes, and we'll use the mnemonic FPNL for full term, premature, abortion, and living. Along with the OB history goes the GYN history, and for our GYN history, we want to know the age at menarche, the last menstrual period, or LMP for our note, and the most recent pap smear. And finally, the social history, and we're going to begin another transition statement. To better understand, I would like to take your social history, which is strictly confidential. It's very important to help reassure them that this is a strictly confidential information, and ask them their permission. Is that all right? We're going to divide it into work, sex, and alcohol and drugs, and we'll start with work to build up to the more intimate parts of their social history. So for work, or if they're not working, what did you do for work? And we'll quantify with how long did you work at, and qualify with did they like it. For their sexual history, we want to ask them if they're sexually active, and we'll quantify with how long have you been together, and then qualify with how is the relationship. Do you feel safe? For alcohol, we do not want to make the patient count. We want to be able to count ourselves. So we break it down and can ask them, how many drinks are you having during the week, and how many are you having on the weekend? And we can use a cage questionnaire to ask them about quitting. Have you ever felt the need to cut down or be annoyed at your drinking or felt guilty, or have the need for an eye opener in the morning? A standard drink is 1 12-ounce beer, a 5-ounce wine, or a 1.5-ounce shot. The standard allowance for a male is 2, and the allowance for a female 1. For tobacco, we want to ask specifically how many packs or cigarettes per day, and then qualify with any thoughts on quitting. Although the calculation for pack years is not necessary, it's included here. If we're given the pack per day, we'll multiply that by the years that they've been a smoker. For example, 2 packs a day for 20 years would give them a 40-pack year. Or if we're given the cigarettes per day, we divide the cigarettes per day by 20 and multiply that by years that they've been smoking. So 10 cigarettes per day divided by 20 for 6 years gives us a 3-pack year. And finally, drugs. We'll quantify with how long have they been taking these drugs and qualify with their thoughts on quitting. In the upper right-hand corner, we're going to use another transition sentence. I would like to please summarize what you have shared so far, and can you please let me know if I missed anything? And then respond by saying thank you and ask them for their insights. What are you most concerned about? And then we'll use the space here where we wrote down our differentials based on the doorway information to teach back some of the differentials that we're concerned for.